January 10, 2023, regular meeting of the Burlington Board of Health. Please join me in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have no approval of minutes tonight, but before we that, introduce myself. I'm Dr. Ed Weiner, Chairman, and with me tonight are board members Andrew Sheehan, Gail DeMore, and our Vice Chair, David McSweeney, is remote. We also have our Director of Public Health, Susan Luminello, our Associate Director of Public Health, Michael Green. We have Associate Health Inspector, Samantha Hardy, and Recording Secretary, Eric Bergeron. Please note we are live on BCAT, and we will be taped. Available for appropriate comments and questions through this video technology. All votes tonight will be roll call as required. And I want to thank BCAT, as I do every single meeting, for what you do, keeping us all so aware and so well informed. We have no approval minutes, as I noted, and now Chairman's report. Well, first, to everyone in the community, Happy New Year. So much to talk about tonight. First and foremost, before I forget, I want to thank Dr. Wayne Salzman, our former Board of Health Chair, who serves as our current Medical Director, for his excellent BCAT interview and discussion on sudden death in sports. To that end, there's not a person that I know who's not talking about the Buffalo Bills' safety, Damar Hamlin. So, someone collapses at home or at a family event or even on the street in front of you. Do you know what to do? Well, it's not going to happen, right? Wrong. I witnessed and came involved in that type of emergency situation, not once but twice. I've been trained in CPR, and most people in this room have, and many of you have. But if you're not, it's time to learn. So many organizations teach CPR, like the American Heart Association, the American Red Cross, even our Burlington Medical Reserve Corps of this Board of Health teaches. It's time to learn. Only takes an evening, a couple of hours, and if you need recertification, get retrained. More than a decade ago, this Board of Health, with full community support and their help and their donations, spearheaded to buy and place AEDs, automated external defibrillators, in many buildings in this town. If your building, sports team, religious organization, children's and youth groups doesn't have an AED, push to get one as soon as possible. It could be your kid, it could be you. Oh, by the way, both of the individuals that I got involved in during a CPR experience, one at a wedding and one on the street, both survived. CPR, cardiopulmonary resuscitation, works. Learn it. Could be you, could be me. Now to 2023, the Board of Health has a lot to do. We're going to hear about two major grants, many thousands of dollars this Board of Health has recently received. Keep an eye out, you'll hear a lot more. And our board, we've got a lot to do in 2023. We have a lot of subcommittees. For instance, our 2024 budget, hazardous material regulations, personnel and hiring. We have two individuals within our board that we will be soon have to hire. And the Burlington professional faculty, which I am working on. So, if you've got time during the day, or if you want to talk about a subcommittee, please ask me. We've got a lot to do. And last, I want to read something from the Special Commission on Local and Regional Public Health that we were given. It's a very large document that we reviewed this week. I want to read from it. No other government agencies are as far-reaching and invisible as local public health departments. No matter where you are, at home, at work, at school, or at play, local public health departments are responsible for ensuring your safety and well-being. And I thank the community for your support. We can move on. Citizens' time. Is there anybody here who is not on the agenda who'd like to talk to the board? Is there anybody online? I don't think so.
No.
So we can go on to hearings. Notice to suspend permit for Board of Health regulations governing food service establishments, 2 Les Jours, 3 Old Concord Road. And our Associate Health Inspector will present.
Okay. You can come up. You can sit right there.
Does he have to sign in, or are we?
You should have to sign it.
I got one. Or
Please have a seat.
Thank you.
So they got that all squared. Okay, so 2 Les Jours is coming today because they had a repeat violation of our local regulation, not having a certified food protection manager on site during the inspection. And that was 5/18 and then 11/30. So after discussion with the manager, Alex, he enrolled some employees and did get some people certified, so I know that was a late admission, but did you guys all see that?
Yeah.
Okay. So I guess it's up to you guys to decide if you feel that they're in compliance or not. And maybe he can speak a little bit about what you did.
Yes.
Mr. Chowdy, is that how you say it?
Yes.
Is it Mr. Chowdy Dewan?
Yes.
Did I say it right?
Yes.
Oh, thank you so much.
Yeah.
I know you go by Alex.
Yeah.
Mr. Dewan, we had full intentions tonight, if you did not come up with 2 individuals to train, to shut you down and and to suspend your license. Did you know that?
Yes.
And you got to tell us why we shouldn't do that.
Oh, so I just got 2 more ServSafe for the 2 new employees.
So why didn't you have them before?
So before, I saw, because I used to have 1 and she just left from the store. So I just got two new ones. And also we open a new location, so I'm in charge to 2 stores, so I don't have time, spend a lot of time in the Burlington one.
Do you understand that someone has to be there for ServSafe to protect the community at all times in Burlington?
Yes.
You do that now.
Yes.
And you understand that if it happens again, as chairman, I will have no problem with suspending your license to operate your permit.
Yes.
So I don't want to see you back again.
Of course not.
Does anyone else want to add to that?
I just have a question. What is the hours of operation that you have these people present on site?
So she gonna be Monday to Thursday, 8 a.m. to 2 p.m. And he gonna be in the store also in the morning, Tuesday, Thursday, Friday, Saturday, Sunday morning, 5 a.m. to 2 p.m. And
How long are you open in the afternoon?
we until close at 8:30. So we also have one person in the afternoon for Monday and Wednesday to Sunday for closing. 2 p.m. to 8:30 p.m.
So you have 3 people fully certified for the Burlington store at
Yes.
all times of operation?
Yes.
Okay, thank you.
And also I got me. I gonna be a substitute if anyone cannot be there. Yeah.
Okay.
So you said at 2 p.m. Who was afterwards? Who was there after 2 p.m.?
So after 2 p.m., this guy, so my store manager,
And he's there until what time?
8:30 p.m. Yeah.
So it sounds
Mr.
like
Chairman,
you have
if I
4?
can.
1 second.
I'm sorry.
Thank you.
It sounds like
that's
you have 4 people certified now?
Yes, I have. 4.
Okay, I thought it was just 2.
We just
4.
got 2 more. Yeah.
Okay.
Yeah.
That's good.
Yeah. Thank you.
Mr. McSweeney.
So, and I apologize, I can't see the owner on the camera. So how many employees do you have in Burlington?
Total around 20, I think. 20.
So, and you only have 4 that are going to be certified?
Now it's gonna be 4, but I'm going to get at least 1 more.
Yeah, and I just, and excuse my abruptness, but I don't feel like you're taking this very seriously. And this is, something that we take very seriously. And I just don't feel like, an additional 2 people are going to cut it, particularly with days off and sicknesses, vacation time. I think you're just going to be constantly chasing your tail with this. So I really would love to see a more substantial plan and to take this a little bit more seriously than what you are, because this is something that the Board of Health takes very seriously, and we have proven track record that this does protect the community. I just would like to see you step up to the plate a little bit more.
What he's saying is he'd like you to consider more people of your 20 employees to be certified. Did everybody passed?
Yes, everybody passed.
Everybody passed?
Yes.
Your other employees, your other 16 employees, it didn't take long for them to learn and pass, did it?
No.
The others,
Yeah.
maybe you should do as many more as you can.
Yes, I will get at least 1 more to as soon as possible, because right now the employees is always come in and then left. So I want the employee stable, working here longer, and then I get a certificate for him or for her.
Okay.
Yeah.
I just want to warn you, please, we don't want this to happen again. It's been twice now.
Yeah.
Thank you.
Yeah. I will promise.
Oh,
won't
well, I
happen.
appreciate that.
Yeah.
We understand, but, do you play baseball?
No.
No baseball.
No
3 strikes and you're out,
Oh, okay.
right?
Yeah.
So, Ms. Director, we can choose to do nothing, or we can choose to
Yeah,
Suspend.
if the board determines that they are in compliance, then you can choose to, do nothing, or you can choose to suspend. And I suppose you could choose to, have him back if you wanted to, if you're not totally comfortable and wanting him to get more people trained, come back to the board, with a plan or evidence of more people being trained. I mean, I think the difficulty here is, like he said, is that, if there is a high turnover rate, you get somebody trained and then they're gone. So it's tends to be, sometimes difficult to keep everyone, get new hires trained.
Do we have a specific percentage of employees that we require?
No.
Okay.
Because
It's
it's so
coverage all the time.
different. So, somebody might, I was thinking that, but I don't think that would work.
Like a certain
because-
percentage of the total employees.
Yeah, because it's all going to depend on what hours they work,
variable, yeah.
how long they're open.
Fluctuates, right?
Yeah.
When do you inspect, again, approximately?
Well, if their inspection was last done in November, it would be 6 months from there. So that would be May.
So maybe we could ask our associate inspector, maybe at some time within the 6 months to drop in. They're within the H-Mart building, is that correct? Mm-hmm. You're within H-Mart?
Yes.
That is correct. So maybe you could drop in sometime and check the status?
Absolutely.
I would be okay with that.
I'd be in favor of that.
Yeah, just to
Okay.
check up.
Mr. McSweeney, would that be all right with you?
Yeah, for sure. I think he understands the urgency and our, the severity around complying. So, and I think if we can speed up another inspection, obviously giving him a fair amount of time to get the other folks trained up, I think that makes sense.
So if there's no motion, and I see no motion here, thank you for coming.
Yeah, thank you guys.
We're not doing anything. Thank you for coming. You showed us the new certificates, but beware, our associate health inspector could show up at any time.
Okay.
Okay.
I will get like at least one more worker to get certificate.
As long as there's somebody there.
Yes.
Be well. Happy New Year.
Yeah, thank you. So, I'm able to leave? Or
Yes, you're.
Yes.
Thank you for coming.
how about the paper? Here, please.
No, you can leave
Oh,
that.
you signed in?
You just leave it.
Okay. Thank you.
Under discussion now, sign board initiative, and that is our director going to present that?
Yeah, and basically, the town administration would like to put up a sign on the town common where the banner is. I don't know if on the corner there's a banner. That to be replaced with an electronic type of sign. You've probably seen them in other communities. They have, postings going on and can be used in an emergency situation. So they're going to town meeting January 23rd, and the town administrator asked that the board, consider it and is looking for support for the sign. And it is true, the Board of Health uses that banner and can use the sign space for all of our events, the flu clinic, the health fair, flu shots, emergencies going on. The town's been really good about letting us use the lighted sign for those types of things, but this is going to you're going to be able to put more words on it, people will be able to read it easier, that type of thing.
I spoke to Mr. Sagarino tonight. It's a town meeting warrant. I'm not sure if it's backed or not backed by the planning board. However, he would like support. I feel it's a tool to keep the community more informed, especially during emergency situations, during flu season, during COVID season. For many of the programs that we run, and I've seen it in many other towns done very nicely, but apparently our zoning does not allow for it. So he is asking us to support it, and I think as major users of it, I am in favor. Mr. Sagarino was very good. Has it well thought out. So that just, does he looking for a vote from us?
I think so, yeah. A vote of support, yeah.
How does everyone else feel about it?
Personally, I think it's a good idea. It's a quick, easy way to get messages out. It's a good spot, and I think the electronic way is probably bringing us to the 21st century.
It's a busy spot.
Yeah.
So it gets visibility, but that also brings a little bit of,
taking your eyes off the road, quite frankly. So that's a little bit of a concern. Is there a fee associated with this? Is the town going to have to pay like 30 or 40?
They're going to be able to remotely change the sign. They have to buy the sign.
So they have to buy the sign?
Yeah. Right now, we have that big, ugly, in my opinion, it's ugly, DPW sign that's up there, up on the hill.
Oh, yeah.
Which is horrible.
Replace that?
That'll be replaced.
Okay.
But that was my understanding with Mr. Sagarino.
And it's also my understanding that, with regards to traffic, that's taken into consideration, like that it is a high-traffic area, so they're careful about like how often they change how often the message switches, like how much it flashes, like that type of thing.
Yeah.
So I think that, the police are involved, the traffic people are involved in trying to
gonna be
make
on
it
a
as safe
timer.
as possible. I mean,
Yeah.
I think that's one of the goals, is
Yeah.
to make sure it's safe. So,
Who's going to be in charge of it in regards to like getting the message on the sign?
usually, well, the way that the banner thing works now is that you have to get permission from like one local town department to put up your message.
Right.
So I'm assuming it would be the administrator's office with regards to what messages go up and when. One of the things that, the problems with the banner is like, we have banners, you gotta store them, you gotta get somebody to pick them up and bring them over there. Then the dates are sometimes, you gotta change the dates of things going on, then you gotta pay to get the banner changed. So it is very cumbersome way of messaging those banners.
Anybody else?
Yeah, I was gonna say, I am full of support of it. We're way behind the times. We have to find and continue to evolve to communicate with our residents on a regular basis, particularly for for the benefits of these other programs and/or maybe even school cancellations and so forth and so on. I think we should have done it years ago, realizing that we could have done it years ago, but way behind the times. I'm fully supportive of it. And I'll make a motion to recommend or to support the addition and purchase of the electronic LED sign.
It would be in support of the zoning change.
Of the zoning change, yes.
Okay, so, any second?
Oh, I second.
Mr. Murray seconds. Any other discussion? I just wanted you to know, I did mention to both our director and Mr. Sagarino that I would like it to in emergency situations, to flash. And he said, well, we would have to take into account, as our director noted, the safety of the drivers who may...
Could trigger something.
It could trigger something. But it's a good way of immediate communication.
Agree.
Well, we also have that reverse 911, so we do have some, yeah.
But this is just that-
No, I agree. I just look at it from a cautionary, because of location, it's a major intersection
I
in town,
understand.
and there's kids going back and forth lots of times, so that was my only concern.
Yeah.
Good points. So I have a motion, I have a second. No other discussion? All in favor? Aye. No, I cannot do that. I have to do a roll call every single, and I want to make sure that I have all this down right, to make sure. To roll call, yeah, I got to do roll call. Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Ms. Amore?
Aye.
And I vote aye, 4-0-0. Which now brings us to our next discussion, and that is a presentation by our director on the Public Health Excellence Grant that we have just received. And just to note that we are going to have a press conference on this on February 15th. At what time?
So that would be our meet and greet or kickoff meeting for the grant, and that is at 3 p.m. on the 15th, and you'll all be getting an invitation. So it's going to be with, all the boards of health, the administrations from Burlington, Lexington, and Bloomington will be invited
And where will we have it?
at Grandview.
At Grandview, and then we'll notify the press.
Okay.
Okay, and the selectmen and whomever.
Yep.
So I think it,
And I do have a press release I'm going to send out. I wanted to send it out after this meeting, so I'll send that out tomorrow.
please.
Great.
This is a big deal, because this is, and we just received a second grant. We're going to,
20,000.
another 20,000.
Oh, yeah, I saw that.
So we're getting,
And Marlene received another grant under the FDA standards for 5,000, so.
we're
Wow.
getting close to $1 million with everything put together
Yeah,
over 3 years.
yeah. Okay, so this is, I wanted to introduce the board to the grant, give you some background before the meeting. So in August 2016, the Special Commission on Local and Regional Public Health was created by a legislative resolve signed by Governor Baker. The commission was a 25-member body charged to assess the effectiveness and efficiency of municipal and regional public health systems and to make recommendations regarding how to strengthen the delivery of public health services. In June 2019, the commission completed the Blueprint for Public Health Excellence report, which is included in your materials. One of the recommendations of the report was to increase cross-jurisdictional sharing of public health services in order to strengthen the capacity of the health departments. In April 2020, the State Action for Public Health Excellence Act was passed, creating the Public Health Excellence Grant Program. In January 2020, DPH launched the Mass Municipal Public Health Shared Services Grant Program. On July 21st, the Tri-Town Collaborative, which includes the municipalities of Burlington, Wilmington, and Lexington, was awarded the Public Health Excellence Grant of $300,000 a year for 3 years. Burlington serves as the lead agency of the grant and is responsible for grant management and receives 15% of the grant award for administration of the grant. In November and December, the Public Health Excellence Program initiated a capacity assessment, and that included an extensive questionnaire for all health department directors on the current work or capacity of their health department. You may have, part of that assessment was to provide documentation backing up the answers to the questions, and also part of the assessment, public health staff and board members were asked to complete a questionnaire. So the capacity assessment was pretty extensive for me. It included, took me about an hour to complete, and then it took a lot of additional time to provide them with the backup documentation. You also received links, or should have received links, to complete the questionnaire, and so did Wilmington and Lexington. So we haven't gotten the results of that capacity assessment yet. They're supposed to, the results are supposed to identify areas in which each of the coalitions are lacking so that they can increase capacity in those areas. So it's not done through an individual communities in the coalition, so they're not going to say Burlington needs this, Lexington needs this, Wilmington needs this. It's done as an entire coalition. And again, we're waiting for the results of that capacity assessment. We created a draft budget, so to create a draft budget without the results of the capacity assessment, I met with the directors of Lexington and Wilmington to determine what their needs were. And a draft work plan was submitted on December 15th, and half of the funding has been received by Burlington for fiscal year '23.
So if it's $300,000 for 3 years, they gave us $150,000, they gave us half the 3-year allotment?
Half of the 1-year allotment. So it's $300,000 per year, so we received $150,000, and then I'm assuming in a month or 2 months or whatever, we'll receive the next $150,000, and then when the next fiscal year starts, which is July 1st, we'll probably receive it quarterly at that point. I think we're receiving it half because we're kind of late into the year, so we've only got 2 quarters left, basically.
And what about the administration fees?
Well, so we received $150,000, so we're going to receive the next $150,000. So what I've had to do is to look at the budget and say, okay, what are we going to spend now? and put the 150,000 in different areas of the budget that we currently have now.
No,
So we
don't-
haven't received the whole, we received half of it.
So do we get more money for doing the administration of the budget? Of
Yeah,
the-
we'll get the 15%, which is like 45,000.
We'll get that this year. I'll get the $15,000.
Right, and then we'll get the whole thing before fiscal year '24.
Thank you.
So the fiscal year '23 draft budget, I just wanted to go over, just briefly, because this is going to change too, because things are changing. I'm trying to get the money spent in the best way possible, and, so that it doesn't, we don't hit fiscal year '24 and the money isn't spent. So, but obviously, we can't, there's certain things that we're not going to be able to do, so there's other areas that I want to
Is
focus
it
on.
a use it or lose it kind of thing?
Yeah, if you don't use it, you have to give it back at the end of the
Okay.
fiscal year. Yeah. So I've taken their budget and kind of made it into categories that we normally use with our own budgeting. So I broke it down into salaries, contracted services, materials and supplies, municipal expense, capital outlay, and then the lead agency. The lead agency is different. I mean, that's just, we don't have a category for that. Okay, so for salaries, all of the salaried positions will be part-time, so that's less than 19 hours per week. And they will be Town of Burlington employees overseen by the Director of Public Health. They'll provide services for the coalition, which is the 3 towns, and they're not going to replace, and they're not meant to replace, existing Board of Health staff positions. They're supposed to be in addition to, and augment the work that is currently being done by the 3 communities. The shared service, so right now we have in our budget, shared services coordinator, health inspector, 2 nurses, an epidemiologist, and a community health outreach worker. So right now, we have a shared services coordinator who has been hired. Her name is Katie Capabianco, and Katie came to introduce herself today, so I don't know if you want her to come up now or talk after the presentation about...
What would you like to do, Kate? We know you.
I'll let you finish your presentation.
Okay, and then Katie can come up and
Great.
tell a little bit about herself and introduce herself. One of the things that we're working on is drafting job descriptions for each one of these positions. And Katie is doing that. We've gotten some help from the Mass Municipal Association and from our Human Resources Director, Joanne Faust. So for contracted services, right now, we're waiting for a signed contracted from a contracted inspector to conduct tobacco compliance checks for Burlington. That's, as you probably know, and I've talked about it before, I think it's been difficult to find inspectors who are able to do that. So we're working on it, and hopefully we'll have someone in place to at least do maybe 1 compliance check for Burlington this year. Wilmington and Lexington are on another grant that ends fiscal year, at the end of this fiscal year, for tobacco compliance checks and tobacco inspections. So once their grant ends, they're going to want to be put on for fiscal year '24 for, if we get this person in place, for all 3 communities. But for just this year, hopefully we can get a contract signed so this person can at least do it for Burlington this year, and then we can get them started and get everything in place prior to next fiscal year. Permitting, so another thing that is under contracted services is permitting and inspectional software, which is needed for both Burlington and Wilmington. Burlington Board of Health staff, in consultation with the IT department, has been looking at various software options, and it's an ongoing right now. It's expected that there's going to be a large upfront cost, but following fiscal year '23, it should just be maintenance costs after that. So right now, Lexington is still using paper. So they, not Lexington, I'm sorry, Wilmington is still using paper. So they want to come in with us on getting some good software to do all of our inspections. So right now, we only use software to do food establishment inspections. I'd like to get a software product that can do all of our inspections, and not only do inspections, but rolled into one, do, have permit applications, have everything all in the same place in the software, so it's like one place for everyone to go to get a permit from the Board of Health. So we have been looking at several options. Mike has been working on that and setting up meetings and looking at the different software products. Katie's been getting estimates, and I'm hoping soon that we'll be able to make a decision. I'm leaning towards one of the companies, but it's been, the cost is really high. So I'm hoping to talk to them next week, see if I can get the cost down, and then on board with them, hopefully. So if we, right now, like I said, we're not going to be able to hire these people. So I want to get the upfront cost for things like the software done now, because next year, hopefully, we'll get some people on board, and then, we want to pay for the things that we can now. Okay. So materials and supplies. Oh, I'm sorry, one other thing I forgot was the translation services. So we've contracted now with the translation services that's going to provide 24/7 translation services over the phone. So there's a phone number, you can call the phone number, you can pre-program the languages that you want, so it'll be able to be used by the inspectors out in the field, it'll be able to be used by the nurse when she's doing vaccinations. Whenever we have to speak to someone, we can just call the number and instantly use the 24/7 translation line. And you get charged when you use it. So that number will also be provided to Wilmington and Lexington, and I've set aside some money in the budget for that. Also part of that is translation of documents. So we've identified several documents that we'd like to get translated. Marlene has gone through all of her documents and given me a long list of documents she'd like to see translated in what languages. So we're going to start with that, get these, use the time now, the money that we have now to do this bulk of the translation services while we have the money in the budget to do that. Materials and supplies, this is just for supplies for the position. So if the part-time nurse or part-time inspector needs certain supplies, we've had some money set aside for that. Municipal expense includes mileage reimbursement for the grant-funded staff, professional membership fees for new and existing public health staff. So this is something that we normally take out of our budget that we can now take out of this budget. So all of our staff members belong to Massachusetts Health Officers Association, Massachusetts Environmental Health Association, the Massachusetts Public Health Nurses Association. So all of those membership fees for the 3 communities can now come out of this budget. And it's just for Massachusetts organizations. And training and credentialing as well can come out of this for new and existing public health staff. One of the things that they're working on is creating, they're calling them hubs, training hubs in the area. So there'll be a training hub, for our area that we can go to, and it'll be free training for all of our staff. So they haven't gotten these hubs set up yet, but they are starting to provide this training. We just had a notice today of a training on the new housing regulations that is going to be coming out of the public health excellence budget, not our budget, but the state budget for the hub to do the training. So I think that's a good idea. That's something that really is needed.
Can Board of Health members get trained under some of these?
Yes.
I just want to make sure. I know
any Board of Health member wants any training, that will be paid for.
I know that under materials and supplies, we have talked about some minor protective wear for the Board of Health because of what we do.
Yeah.
But also with trainings, if there's a training.
Can I just ask a clarifying question? When you say you're ordering, or not ordering, but hiring part-time employees through the grant, are you hiring 3, 1 for each town, or are you just hiring a part-time person that will float?
float, because the intention is to share.
Okay, that's what I
So-
thought. I'm thinking part-time, that's not a lot of time, but maybe a day here in Burlington, a day there in
Yeah.
Wellington. I'm just curious how.
Yeah, it would be, and it also depend on the needs of the individual communities too.
Right, right.
But overseen by the lead agency.
Right.
So, okay.
There's one other piece here. This is going to put tremendous pressure on our administrative director, you. And it's going to take a lot more time outside your current position. Will this allow for some time to be paid outside of your position?
Yes, and that's allowed under the lead agency portion of it. So
Because
that's
we
my
have a
next
lot of
slide.
leaders in this community who get stipends for other initiatives. Will you and whom else be able to do that?
Yes, for supervision, for grant supervision, you
Yes.
can.
Okay.
Yeah, yeah. So, and I'm going to get to that. So-
Okay, because I'm all for that.
Okay. And then the capital outlay, another topic, is for technology hardware for grant-funded staff. So this is hardware items like computers, printers, tablets. And then facility operations are expenses for facilities for grant-funded staff. So currently, we're working on room 231, which is in our building, right near the Board of Health offices. The COA is now using it for bus drivers.
Storage.
And storage. And, I'm working with the town administration, IT, and facilities. One of the things what I would like to do would be to create that room as a shared services room and put in several stations in there for the staff to use, because they're going to have to,
Come and go.
even though they'll be part-time, I'm going to have a place to put
They'll
them.
need a spot.
Yeah, so there is a part in the budget where you can use facility operations. One of the things that came up is that room needs a lot of upgrades, evidently, to be able to hook up that many computers and phones, and also gonna need an electrician. So I had to get estimates do the upgrade of the room. I met today with the town administration, facilities, COA, and IT about, how we're going to go about that. Evidently, the switch things takes a long time to get them.
Yeah, and also
So
this-
I might have to move it to fiscal year '24 budget, but get the work done in '23. So that's something that is going to take some time to figure out.
Because
I
of
got to figure out that room before I can hire anyone.
Because of proprietary nature of the use of phones and use of computers there, you can't just stick a modem,
Oh, right.
okay?
So,
Use an extension cord? No, just kidding.
but yeah, evidently there's like some kind of firewall in between and it can't run wires.
Right.
Yeah. So, but that's allowed in the budget to upgrade facilities so that you can house people.
Right.
And then the lead agency, so that's 15% administrative fee to cover grant administration and supervision. So like Ed was saying, I am going to be spending a lot more time on this grant, and I'm looking at, and I did reach out to the town administrator, sent him a memo on what we wanted to do. He said he's okay with it, and it's allowed under the grant to work some extra hours and put in the stipend for the extra hours that are worked. And then, so the next steps will be the public announcement, which I have written and I'll send out tomorrow. I also ran that by the Lexington and Wilmington health directors, and I put in a quote from myself, told them, feel free to run it in your communities, put in a quote from yourself if you want. They can just use the template and just insert their own quote so they can put it out in their cities and towns.
Now, where are you sending this?
I'll send it to our normal, like the daily paper, the B yeah, BCAT, and that's usually where we send them.
Any of the electronic, the buzz?
The buzz, we can
You
send
can
them.
send it to the
Nikki,
buzz,
yeah.
please.
Yeah.
Please send to the buzz, and I will probably pass it on to the networks, TV networks.
Okay. I was looking for a more official public announcement from DPH, and they haven't gotten it to me. So instead of waiting, so I decided to just write it on my own. So.
Thank you.
Great.
And then the kickoff meeting or the meet and greet meeting, that's February 15th from 3 to 4. Hopefully you all can come and meet the other boards of health from Wilmington and Lexington, as well as the administrations there. And then the grant implementation, so that's the facility setup is first, then the job postings, and then the software setup. I'm hoping the software, we can, Katie's been working really hard on trying to get some of this money spent, and that will be like, we've done the translation, and we'll be continuing working on that, and the next step is to figure out, get going on the software and get that started to get implemented. Lexington has already invested a lot of time and resources into another software program, so they're not interested in jumping on board with this right now, but maybe they will, like, in the future. So
What is their software like, do you know?
they're using a software called WinWham, and that was one of the ones that we looked at, but we just didn't think it was right for us because it's not cloud-based. So that can be a problem. You need a server, and you need to, you need to be able to download it when you get back, and then you could lose information. So, after talking to the IT department, we thought a cloud-based software would be best. I mean, maybe it's more expensive, but I think.
Well, is it a pay-per-use, is it a pay-per-use scenario, like a traditional cloud pay-as-you-go service?
It's a maintenance fee, a yearly maintenance fee. So you get it all set up, and then you pay, a maintenance fee. I guess it depends on how many modules you have on the system. We're looking at quite a few modules, so when we did it all, I think it was at least 10 different permitting modules that we'd like to use, with our biggest being food and hazardous materials, probably.
And then if if the other towns join that, is that more modules under ours, or did they get their
So
separate system?
The nice thing about the one that we're looking at, and it's Tyler Tech, is that they do a lot of work in other states. They haven't done a lot in Massachusetts, but in other states, health departments are regionalized, so they're more county-wide, or they cover a larger area. So they don't go by city, town, that type of thing. They just go by number of users. So we just tell them how many users we want, and then they give us a monthly fee for the amount of users. So if Lexington comes on later on, it might be however many users they want. And then, so we'll have users for each city and town, but then also the users will be the shared services people that are doing inspections.
Right.
Yeah. Yeah. And that's it. I don't know. Katie, you want to come up?
Yeah, we've known Katie for many years. She has been an part of our administration now for 3 or 4 years.
5 years now.
5 years. Please introduce yourself, tell us your background, and what you're going to do here. We're thrilled you're going to be doing this.
Great. Can you hear me okay?
Sure.
So just to start, I've been a resident of Burlington for about 28 years now. I'm married with 2 college-age students. I started my career in accounting with the Environmental Protection Agency many years ago. I went on to become a special agent criminal investigator for the federal government. And when my children were born, I went part-time and was the special investigator for the U.S. Department of State Diplomatic Security. For the past 5 years, I've been at the Board of Health in a dual role as the Public Health Emergency Preparedness Assistant and an admin for the Burlington Volunteer Reserve Corps. So I feel very enthusiastic about the new role. I feel like my background in accounting, experience with the federal government, the Board of Health has prepared me well for this new role as the Shared Services Coordinator. And I'm excited. It's something new. It's building something new from the ground up, and it's got a lot of moving parts. I like a good challenge, and it's great. I'm excited to still be working at the Board of Health under Susan, and I look forward to working with Joanne Belanger. She's the Director of the Board of Health at Lexington, and Shelley Newhouse at Wilmington. She's the Director of the Board of Health at Wilmington.
Nice.
Great.
Welcome.
Exciting.
Yeah.
It's fun to start something new.
It's nice in yourself. Will she also continue work with her other positions also?
No, so she doesn't want to work too many hours, and it's
Yeah.
limited to the 19 hours per week.
So she'll
The other
slide
position-
there.
So yeah, the position that Katie was in was a grant and goes to the end of this fiscal year, but we're going to end up returning those funds.
Okay.
Rather than, I don't think we'll be able to find somebody in that short amount of
could take
time.
that.
Yeah, to do that role, and then it wouldn't be fair to them to say, if the grant wasn't re-upped or something. And honestly, too, I mean, I think, I don't know if that is needed as much anymore as it was, too. But, I mean, I guess we'll see. Those funds come from the emergency preparedness funds. I don't know what's going to happen with those in the future. This is the way that the DPH is moving with giving out grants,
Reorganizing
giving out
mass,
funds.
yeah.
So, I just have a feeling that I think that those funds are going to try somehow in the future
Be
get rolled
absorbed.
into this type of thing. And everything's going to be according to this, because there's a lot of time, energy, effort being put into this blueprint for excellence report and rolling out these funds and getting all health departments. The goal is to get all health departments on the same level and being able to meet all the same requirements. So, yeah. So I don't anticipate applying for that grant again next year.
Which is fine, because we're not, you kind
Don't need
of,
it.
it fluctuates. When you need it, and when you
Yeah.
don't, you kind of have to let it go.
Yeah, and I will say Katie was an amazing help during COVID. I mean, because we had so many people coming and wanting to volunteer, and Katie was vetting them all. She was getting them all the information they needed. She was getting them all signed up, getting them all sorried, and it was just, just constant coming in of volunteers during the whole 2 or 3 years anyways, right?
We doubled our number. Our volunteers went from 160 to 330 within 2 years.
Yeah.
Sandy, thank you for coming,
Oh, you're welcome.
and thank you for deciding to stay.
Yes.
We're really happy about
It
it.
was an easy decision.
Oh,
It's a
that's
great,
nice.
great team at the Board of Health.
Thank you so much.
Good.
I say that a little louder because the camera may have not heard you. A great, what else?
It's a great team to work with.
Thank you very much.
Okay.
Good night, thank you for coming. Thank you very much, Susan, for the presentation.
I mean, just writing a grant takes so much work and organization and research, so thank you for doing that for the town. It's great.
Thank you. Yeah, and like I said, I think it's going to be constant reallocating of money and funds to different areas as we go along. It's based on what we feel that the needs are and
Right.
what we want to work on.
And it's not only us, it's other people,
Yeah,
the other towns too.
This is an opportunity for public health.
Right.
It's not just an opportunity for this board, Lexington and Wilmington, it's a public health opportunity.
Yeah.
And I think that's very important. So, thank you. Staff reports, Associate Health Inspector. Do you have anything to present?
Not too much. I mean, I think it's pretty straightforward. I have been working on, looking at the new housing code, and I just signed up to do the training on that, so hopefully that will be helpful with all the new, they did decide to change all of the codes on us, so it should be fun to learn a new code. And I guess the other thing is we opened a couple new tobacco shops in town. I think that's about it.
Any questions? I just have one. Town and Country was a flavored tobacco problem, I should say.
Yes.
And you were in charge, you were the one who discovered that. Thank you. And maybe just let everyone know what that was about.
So they, when I went in to do a routine inspection, and I noticed a product that looked to me to be flavored, and asked for the paperwork, that they were required to have that, certifies that it's not flavored and the content of nicotine. They didn't have one. I, went online, and it's pretty obvious that it was a flavored product. So they were issued a fine for that.
Now, does that fine go to the state or does it come to the town? Do we know that?
So it's a criminal fine, so it's a totally different process from the non-criminal fines that we usually write. So it goes to it does go through the town clerk's office. If it doesn't get paid, then we petition the court, and then the court would take over to ensure that it got paid. So.
But who does the money go to? The town?
Oh, it goes to, yes, it goes to the town, it goes to the general fund.
It goes to general fund, that's what I'm asking, because it didn't say that. Thank you.
The same as the other tickets where, I believe they go to the general fund.
Do we know if the fine has been paid yet?
It has, yeah, so we've been looking at that, so we kept an eye on that, made sure that it was, and if it wasn't, then we would have petitioned the court. Another thing is hopefully this won't happen again, but if she found another violation, another flavored product, it would then be a higher fine, which I believe it's $2,000, and a suspension, so they would be before the board.
Okay.
For a second time. The first time, they're not before the board, second time they would be.
And that's with the new regulations that were.
Right.
Yeah.
Okay.
Good eye.
Do I have a
Good
motion
eyesight.
to approve the Associate Health Inspector's report?
Motion.
I have a motion by Andrea, second by
Second.
Gail. All in favor?
Aye.
I have to. All in favor?
roll call.
I got to go through it.
Roll call.
Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Ms. Demore?
Aye.
And I vote aye, 400. Thank you. Associate Director of Public Health. Mr. Green, do you have anything to point out?
I do. If you look at the report, I did meet with Jennifer Nett. She's our region liaison for the MRC at the national level, and she wanted to meet about our technical assessment. And if we go onto our unit website, there's MRC factors for success and a big questionnaire with about 80 questions on how we kind of administer our MRC. And Susan's been handing me a little bit more in regard to duties to the MRC, so that was one of the activities I get to do. And going through the factors for success, we were able to, we were noted as being one of the exceptional MRCs in the area. I think that's due to a lot of hard work from Susan and Katie. But we did identify a few areas we could improve upon. One of those was our required training courses that we offer our volunteers. There's 3 of those, MRC 101, ICS 100 and NIM 700, and we wanted to see kind of where we were at with our volunteers getting those minimum courses completed, and we are not achieving 25%, so that's going to be one of the areas we're going to work on in the future is to get, we're at 24.78%. So it's not going to take much to get us to 25, but once we're at 25, then we're going to be shooting for 50. And with that large increase in volunteers, like Katie was saying, 160 to 330, I think that's where we've...
And I urge all board members to take 100 and 700. I've passed them both. They're very interesting and very useful. You do it in your own time, and I urge you both to take those two courses.
You said 100 and 700?
100 and then and 700. Does not take a long time. Okay, any other questions? I have one. Tomorrow night, is tomorrow night American Sign Language? No, tomorrow night is, do you have a program that you up?
We do. We've got Through the Lens, Understanding the Autism Profile Training.
The Autism Profile Training. And where is it being held?
That one is 5 to 7, and or I think we're online for that one, no?
No, the room down the hall.
Oh, yeah, room 207 at the Board of Health.
207. And it's open to everyone.
Well,
MRC members.
MRC and, yeah.
So, very good. See you tomorrow night. Do we have a health fair date?
I'm looking at May 20th of this year. Yep, we're, after some debate, I think we're going to do it at the Common again, do another outside event, because I think that went really well. It was very popular. So I'm going to be working with the rec department.
Later is better in the month, yeah.
Yeah, just as long as you can guarantee good weather, we're good to go.
I will. Any other questions for our Associate Director of Public Health? If not, do I have a motion?
Motion.
By Mr. Morris, second by Andrew. Because all in favor, Vice Chair David McSweeney. Andrew Sheehan.
Aye.
Dale DeMore.
Aye.
And I vote aye, 400. And last, Director of Public Health. Now, this will include the environmental engineer and the health agent. So why don't we just start with the environmental engineer? Is there anything that you'd like to point out from her reports?
Yeah, the technical assistance grant that we applied for DPH. Christine did a lot of work on that. DEP. It's a DEP grant.
The waste disposal,
Actually, so it's to
the tag.
Yes, that's it. Yep.
Yep.
And it is to look at, you have to identify a site in town that you feel needs more looking at with regards to site contamination. So we've always thought that the area down off Terry Ave, is some complicated sites down there, and identified that under this grant, and it allows for us to hire a LSP or an environmental professional to look at the area and then provide information to the board and to the public on what's going on there. So we want them to do a presentation to the board and then also maybe a public forum and let people know, this is, we reviewed all the files, this is what's going on here. And also to look at, one of the things that we did put in the grant was, do we need a public involvement plan? So a public involvement plan is that we need, it's something that's in the Massachusetts contingency plan, and it allows for either a group of residents through petition or the local Board of Health to say to DEP, this is a site that we feel we need to look at closer. We want to have more forums on this, more information coming forward for whatever reason. There has to be a reason for it, but, for some reason. So that's why we want, we thought that this area would be good for this grant. And in the DEP put out an announcement about it. It's in your materials. I didn't know they were putting out, all that they've sent me now is you've been approved type of thing. And But we need to start looking at writing a scope of work for an environmental consultant and what can be done. $15,000, $20,000 isn't a lot of money for an environmental consultant, so it's very limited in what actually can be done, but it's really, there's no sampling or anything like that. It's just kind of looking at the site and looking at, and providing information to the board and to the public. So at the next Board of Health meeting, I was thinking it might be a good idea for Christine to do the same type of presentation that I did on the TAG grant, to provide you with more information on the sites there, and so that you get an idea of what is going to be involved in this grant.
It's a very old site.
So it's an old site, and then there's new sites that have been discovered, you know, on.
The question is, do we know who the polluter was, who the person release was?
So there's more than one release identified in the area.
It's very
And I think
complicated.
that's why it's complicated too, is because that's the question. Can this site claim downgrading property status, and one of the sites can't, so it's not so clear cut on which way it's running. There was, in reports, there was talk about there's a conduit, you know, that the contamination is coming down through. I mean, and the main reason why we're concerned, and we're always concerned, is for indoor air. So that's volatiles coming up from the ground into an existing building. So that's, you know, any new building that's been put down there. So for example, the medical building that was put there, the board, one of their recommendations was to put in a vapor barrier.
An active vapor
An active vapor barrier, because of that reason of what's going on there. So, and then there's been a site that, you know, they did some indoor sampling and they discovered indoor air issues and had to put in a vapor barrier. So there's been things going on down there and it's really kind of unclear, I think, because sometimes when you have sites that are being looked at through the MCP, the responsible party is only looking at their individual site. They don't always look at the big picture, you know, so we just kind of want somebody to kind of look at the big picture, see if they can give more information to us about what's going on.
Thank you. Now we have the health agent. Is there anything you'd like to talk to us about the health agent?
But Marlene applied for and got another $5,000 for the NEHART grant. She's going to be working on additional standards with Sam. Sam, do you know what standards they are that?
I think we're working on 5, 7, and we're going to try to do 6.
Possibly the third.
Yeah, we'll start looking into 6.
And those are?
So standard 5 is working on the response to an illness,
Okay.
so an outbreak investigation. And standard 7 is focused on like outreach with the stakeholders, so your restaurant owners, the public, just like an outreach. So we're planning on trying to do some education with the food establishments.
Thank you very much.
And another thing that Marlene is doing is the Certified Food Protection Manager training. So she's been certified as a trainer. She's looking at hopefully doing one, I believe it's in March, that she set up a date. She's going to invite certain establishments to come and continue that on a regular basis. That's going to, we're going to, they're only going to have to pay for the materials, so the book that's required, that we're not, you know, not gaining any fees or anything from it, just they'll pay for their materials, and then, and Marlene will do the class. So that's going to be a great service to these people, especially because they do have high turnover rates. For the smaller establishments, it's going to be, I think, a big benefit to them.
That's great.
And she did all of that through the grant that she got last year.
And she's doing tobacco permit renewals.
Yes, I believe that's coming up. Yeah.
Which leads me now to the Director of Public Health. I think you've reported on everything. I don't think there's anything left. I had a whole list here. I've checked off everything. But if anybody else, is there anything that you think we missed?
Well, one thing, when you were talking about the AEDs, the BVRC, the Volunteer Reserve Corps, has a CPR AED training coming up on February 15th. And that was paid for under the RISE grant, which comes from NACCHO. So we were able to fit that in because we got additional funds through the NACCHO grant. And then we also, through that grant and also from the MRC money, is we have 2 dates for first aid and bloodborne pathogen training in January 25th and February 8th. We're gonna have 2 dates coming up there. So if there's anybody out in the public that, it's a good benefit, that you get from being a volunteer. You can take these trainings for free. You can sign up on maresponds.org, become a volunteer, and then we will contact you, and you can take these trainings with us, so.
The blood-borne illness training and safety training is outstanding. I took it prior to COVID, and was it good? And so I urge, if you've got the time, tomorrow night should be really good on autism. I go to most of these. The CPR is the 15th. You can sign up.
February 15th.
15th. Everybody, as you heard me tonight, should be able to do CPR, and then the 25th. So there's a lot going on. Do I have a motion to approve? Oh, I should say, does anybody else have any more questions for our director? Do I have a motion to approve the director's report?
Motion.
I have a motion by Andrew Sheehan, second by Gail Demore. I'm going to say all in favor. Vice Chair David McSweeney.
Aye.
Andrew Sheehan.
Aye.
Gail Demore.
Aye.
I vote aye, 5-0-0. Well, I thought we were going to have a short meeting tonight. We've been here a long time. But Happy New Year, everybody. Does anybody want to say anything else before I say motion to adjourn? Motion to adjourn, please.
Motion.
I have a motion to adjourn by Andrew Sheehan, second by Gail Demore. All in favor? David?
Aye.
Andrew?
Aye.
Gail?
Aye.
I vote aye. Good night, everybody.
Good night.
Thanks, folks. Have a good night.
Good night, David.
If